want to talk about two topics. One is the value of asking open-ended questions about prior treatment when you're dealing with a new client, and the other topic is the value sometimes of therapeutic silence. And my story starts many years ago when I went to visit my mother in Colorado, and as I was leaving her house for a while during the day, I went out into the street to get in my car, and someone was driving down a snowy road and stopped his pickup truck and got out, and he said, have you seen some kind of dog? And I said, no, I hadn't. And then he said to me, aren't you Dr. John? And I said, yes, I'm Dr. John. I still couldn't picture who he was. He said, you treated me years ago at the University Counseling Center when I had OCD and I was showering. And I looked at him and then I remembered him. And he said, yes, you told me, you helped me, and I'm still doing pretty well, so thank you, I appreciate that. And later it came back to me, the whole story of my treatment of him. He came to me at the counseling center and he told me he was showering for 8 hours a day. And he was doing this because he was a minister for a religious group, a Christian religious group, and he was also a student there at the university. And so he said he'd see female students wearing spandex, tight clothes, and that would lead to lustful thoughts in him. And then he'd have this strong urge to shower, and he would shower, and he'd shower for hour after hour. When you shower for a long time, there are two problems. One is, if you shower 8 hours a day, it doesn't leave much time for either ministering or for studying. The other problem is, particularly back then, if you shower for 8 hours, after an hour or so, there's no hot water left. So you're in there for 7 hours of a cold shower. And maybe that suited his interests to try to suppress his sexual arousal, but he knew it wasn't good for him, and he knew it was abnormal, and he wanted to get over it. So I asked him what I thought was a good question: have you had this problem before? And he said, yes, I did a few years ago. And so I asked him the obvious question, what did you do about it? And he said, well, I went to a psychologist, and the psychologist told me to do this and that. And remembering back now, I can't remember what that exactly was that the psychologist told him to do, but it probably involved exposure and response prevention, because that's the usual treatment. And so I asked him the next logical question, so what was the result of that, doing this and that? And he said, oh, it worked. I stopped my showering and I felt much better. I was able to get back into life. And so then I knew the thing to do was to say nothing, and I just looked at him. And I looked at him, it seemed like many, many seconds, but it was probably just a short time. And then all of a sudden he started. He said, oh, maybe I ought to do the same thing again. And I said to him, well, it worked once. And he said, oh, maybe it'll work again. And it did. And that was my great contribution to his life, therapeutic silence. I said nothing. I did nothing other than look at him. So I asked a valuable question about prior treatment, and it turned out he had a very important answer, that he had done something and it had worked before. He had stopped doing those methods, and then it wasn't working anymore, the prior treatment. So as a result of my therapeutic silence, he came to the conclusion that it's time to start doing those same things again, and lo and behold, it worked again. And that's the value sometimes of therapeutic silence.